Let's go to page 5. We on page 508. Okay? 508. Right? Okay. On page 508 last week we talked about ovarian cancer. Right? But we'll talk about it again. I stopped there. I said this cancer grows rapidly, spread fast, and is often bilateral. The problem with this cancer, your main problem is stomach ache, acid, so it really don't look like a cancer. And tomorrow you end up in hospice. There's a marker called CA125. When you have this ovarian cancer, this blood test will be positive. Ovarian cancer, who normally get it? What are the risk factors? It is the same risk factors as endometrial cancer. Newly parity, only have one child, right? People who have cystic, polycystic, increased age, late menopause, family history, obesity, hypertension, diabetes. What happened to you? Postmenopausal, the patient will bleed, backache, stomach ache, that tumor again, 125. They will do both. The risk factors of endometrial cancer is the same risk factor of ovarian cancer. They will do radiation and chemo. Right? Make sure you know that. Ovarian cancer and cervical cancer, not the same. You get cervical cancer sexual. Any question? Breast cancer, very big on NCLEX. Last week, I taught you how to do self-breast exam. Now, breast cancer, it is genetic, but what generic? Grandma, sister, not cousin of the cousin. Risk factors, age. Here's all that apply on NCLEX. Risk factors, highlight that. Age, 45. Early menarche, monkey for me bonnet. Late menopause. What age is menopausal? 45 depends on mommy. A lot of menopause 40s now with the hormone in food. Yes, 40s, late 40s. Late 40s, yes. Menopausal, late, you see sweat. How many of you guys sleep at night, you wake up wet as I don't know what? Yeah. Right? Yeah. That's a sign. Miss Sonia wears sweater all the time. She cold. That's a sign. Hot and cold. Right? Yes. Okay? I know we want babies late 40s, but no good. Mass. Mass usually felt upper outer quadrant. Flex irregular. Okay? Painless. Nipple retraction or elevation. Breast cancer, when it spread to the lung or bone. That is number 12, and that's an NCLEX question. This morning, he asked me to read page 500, box 42-1. I promise you that one didn't kick you on the WhatsApp. About where does the cancer spread? Very, very big. Make sure breast cancer spread to the lung or bone. Number 12. Number 12. Right? This morning, he asked me to read, remember 5, let me give it to you. 499-42-1. Make sure no consa, big time. Okay? No, where the cancer spread. Metastasize. Make sure we know that. Okay? Post-op. I want y'all to go to G, and I want everybody to put NCLEX. And I'm going to read G. I'm on page 509, post-op breast reconstruction. Well, I'm going to do G first, and I'm going to do 4216. Ready? Let me read G. They go NCLEX question. Number 1. After a mastectomy, priorities vitals. Position the client, position the client in semi-follow position. Turn her from the back to the unaffected side. Encourage the patient, cough and deep breathing. If a drain, usually Jackson Pratt, is in place, maintain suction. Monitor for the site for infection, swelling. Monitor for incision. If the breast reconstruction was performed, the client will return from surgery with a surgical brassiere. NCLEX question. En créole, depuis ou fait mastectomie, yo mette un kana soutien. For di son gain, you mette serré. That's an NCLEX question. When the ladies say, what do I wear, regular bra or brassiere? That's what she wears. Sana tesmunyo. Hawaii, Florida, ass. You see it? Everybody see it. Number 7. There you go. Number 8. You're going to put NCLEX. What do you put at the door? On the door, you put no sign, place a sign above the bed that's saying no IV, no injection, no blood pressure, reading, no venom puncture in the affected arm. Yes. For life. Provide the use of a pressure sleeve as an edema sleeve. The patient is given Lasix. That's an NCLEX question. They ask you after a mastectomy what drug they order. Lasix to drain, lower. Lymph nodes. Low salt. Consult the physician and the physical therapy. Not only they will bring physical therapy, the doctor, they will also bring occupational therapy. Any question? Highlight that. Please. Now, 42-16. After mastectomy, you're going to put the arm up. That's an NCLEX question. Positioning, make sure. No tight clothes. Wear gloves. Use thick oven mitts. Use a thimble. Who would you see first? The 50-year-old that was diagnosed with breast cancer. You will always see them first. Be careful. NCLEX will put COPD. NCLEX will put chest pain. Remember. You know why? Because she have a physical, psychological. She can commit suicide. You will see her first. Very tricky. Any question? Turn. Then we go to pancreatic cancer. Very big on NCLEX. Pancreatic cancer, you get it because of number 2. They go to risk factors. Ready? Diabetes, alcohol, smoking, eating high-fat diet, exposure to chemicals. NCLEX question. How you get pancreatic cancer? Sign and symptoms: nausea and vomiting, jaundice, unexplained weight loss, clay-colored stools, glucose intolerance. Number one cancer found in Haitian people after the earthquake because of the radiation. Aboao Jovini, Imperial Point, that Allen West guy, he's a Republican. They chose Broward General. It was Broward Imperial Point. They took 10 Haitian women from Haiti after the earthquake. They wasn't obese. They never smoked. They didn't have diabetes. Yo, tout pancreatic cancer. Only one survived this procedure. They did this in 2011. They did that. They come from Haiti and they came to Alder Brown Hospital dying of pancreatic cancer. Stomach big, poo-poo was gray. All of them, they never smoked. When they did the research, they found out it's because all of these women lived in the same area where the earthquake, radiation. Very important. Make sure we know that. Now, when you have pancreatic cancer, of course it's cancer, so they do radiation and chemo, but they do a whipper. A whipper is you prend the pancreas, you fouet dans ventre là, reroute the pancreas. When they do that, you die right on the table. Here's the whipper. You see it? You see whipper procedure. They right here the picture. You see the picture? They call that. You see it? Whipper procedure, which involves brachiodionotomy. They reroute the pancreas. Because a lot of people think that if there's any chance to save you, die. I told you only one person made it. One lady. Your tooth, Broward in the Core Spring, Imperial Point, they were coming back and forth. Pancreatic cancer.
What does it do when you want the pancreas?
Oh.
Does it stop the...
What did it stop the cancer from growing?
Yeah.
It's supposed to stop the tumor from spreading, but normally it's too late. You bleed to death. Okay? Now, let's go to 511. All I want you to know here, colostomy care. That's why when the students say, Miss Sonia, colostomy care, you teach it in GI. No. You do it in cancer. Here it is. Colostomy care. You're going to get page 511, where E, everybody, highlight E. Colostomy. E. 511 E. 511, you see E? Then you're going to go to 2, post-op, after a colostomy. Here it is. Colostomy, right, will have, a colostomy bag will have formed stool. An ileostomy will have diarrhea. Know that. You with me? Let me show you what Florida did to one of my students. Watch. Place petroleum gauze over the stoma to keep it moist. And keep it covered by a dry sterile dressing. NCLEX question. A, you remember we did peds, something called bladder dystrophy? Bladder dystrophy, you don't put petroleum jelly. You only put petroleum jelly here. And we'll talk about bladder dystrophy in peds when we get there. Place pouch system on the stoma. Monitor the stoma for size, unusual bleeding, and necrotic tissue. D, I want you to put NCLEX, 2PT. E, I want you to put NCLEX. I'm going to read it. F, I want you to put NCLEX. G, I want you to put NCLEX. H, I want you to put NCLEX. I, NCLEX. You see the diamonds? You see all them diamonds? All of those diamonds. I want you to put NCLEX. All that apply. Let me start with C. D, monitor for color changes. That is why CNA cannot change colostomy bag. There's an assessment. Merely note the normal stoma color is red or pink, which indicates high would they say vascular? That means blood flowing, right? Good circulation. They go Florida, go down. So pink is good, right? In your eye, that's what the books say. Go down. Pale pink indicates low hemoglobin and hematocrit level, and that a purple-black stoma indicates what? He was my student, Florida question. The stoma is pink. What is your initial nursing intervention? What did the book say? That's good?
Pink.
That's what the book said. Pink is good. And pale pink, you gotta call the doctor. But NCLEX only put pink, and the answer was call the doctor. See, that's why you gotta understand. Tricky. Your book like do pink going, but Florida Iecture pink, which it didn't say call the doctor, it asked which lab. Anytime it's pink, you must check H&H, because really, it's supposed to be red. Well, c'est peut-être ça student not dit, but the book say, on comprend, we let the book say, we pink pas bon, pink not bad, but pink not good. For NCLEX, I want you to always know that red is best, pink question mark. But she said, but Miss Sonia, remember we did it in class? I said, what did I say in class? She said, I remember, that's why I got it. But Florida put pink. Pink is question mark, red is super good. You got it? Yes, because if it's pink, it may go bad. See, Florida, when you're going to go take the NCLEX, it's about safety.
But early signs of going back.
It's early sign. No. But you, the student who read the book, will say, Miss Sonia, but the book say, don't you comprendre ça book say too? You got it? Yeah, that was her question. She said, ooh, Lord have mercy, Miss Sonia. And we did it in class. Make sure. Monitor the pouch for proper fit. Assess the functioning of the colostomy. Inspect the stool. Listen, what did I tell you guys supposed to be colostomy? Okay, come on. Done. Okay. Oh, hey, I want to show you guys something so we understand good. Solid with the small intestine. So the large intestines, right? So we do a colostomy. Suppose they do the colostomy here. What color the poop will be? Brown, and how form? Ileostomy is what? Diarrhea, because it's the small intestine. Ileum, duodenum, right? So it'll be here. C'est peut-être ça va diarrhea. So if they put a colostomy, so if the patient have a colostomy and it's diarrhea, what is your nursing intervention? Okay, watch this. Colostomy is supposed to be what type of stool? Ileostomy is supposed to be what? Now, liquid. What would cause me to have diarrhea in a colostomy bag? What I eat. So the way NCLEX asks you which question you will ask for what did you eat? White stuff will make my poo-poo what? Sugar. Carbohydrates will make me have what? Jelly. Sugar. Ooh. White stuff. Milk. Jelly. Baby blanc. Brown stuff will make me have what? So the first question you ask them, what did they eat? God, I know it's afternoon, the lunch. Did we get that? That's an NCLEX question. White, what I mean white, jelly blanc, milk, sugar. They munjale, they white, yes, they're carb. Carb causes you to gain weight. Carb is not nutrient.
So, what is that expected food to be liquid depending on where they put it?
Of course, because colostomy, it's supposed to be what? Formed. Oh, now listen. Okay, now I have a colostomy. Which food I don't supposed to eat? Gas. All right. You don't see gas. Talk to me. Brown stuff, wheat, brown rice. Oh, if you eat those, they go boop, 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 boop. Right? Gassy. So, guys, stay away from the norm. The norm is y'all looking for onions, beans. It ain't going to be there. They know you know that. So y'all food won't be my warm. A brown food. You got to understand it's the same. You guys know what the norm is? If I ask you, a patient had left heart failure, what is the sign and symptom? Respiratory. That's not the answer. Because the people know you know that. Easy. The patient have left heart failure. What's priority? Don't give me respiratory. Give me more stuff as respiratory. And don't say take respiratory. That's wrong. Give me more. Has to do respiratory. ABG. High follow. I said respiratory without putting the word respiratory. That is your new NCLEX. Unti respiratoria, by making word respiratory, making a lot more. Do an Allen test. I'm still saying respiratory without saying what? There you go. You see that? That's me NCLEX in Bakabase. There you are. I still say respiratory, but I changed the English. Right? High Fowler, isn't that respiratory? Get 4 pillows, isn't that respiratory? ABGs, isn't that respiratory? Use the incentive spirometer, isn't that respiratory? Allen test, isn't that maybe? You see that? I think I woke up some people. You went, oh yeah. You see that? You gotta know that, guys. Stay away from the norm. The patient is taking blood pressure medication. Check heart rate. Some people know, oh Lord, they know you know that. That's not the answer. That's not the answer. The patient taking atenolol. Watch you give me heart rate, BP. That ain't the answer. Check respiratory. Because atenolol gives you problem with what? They go answer. The patient is taking bronchodilator. What's priority? Sugar. That ain't the answer. What is bronchodilator? LPN. Why do you give bronchodilator? To open the airway. What did Miss Sonia say bronchodilator is? Like giving you coffee. So watch the patient for what? Heart rate and tremor may NCLEX. Do you feel me? Everybody said, well, bronchodilator, watch respiratory. That's the norm. Bronchodilator, do ABGs. That's the norm. You got it? All right. Thank you, Jesus. Anani. Monitor for pouch for leakage. Assess the functioning. Let's go down. Expect loose semi-stool if it's the all they did, they take the colon and break it down. Fecal matter should not be allowed to remain on the skin. No poo-poo on the stoma. Now, empty the pouch when it's 1/3 full. NCLEX. Hey, you see this? Longtemps, you think I'm basic. Empty the stoma 1/3, half. You empty the stoma when it's half. They don't ask that no more. They gonna ask you how to irrigate the stoma, how to clean it, how to give an enema. Can you give an enema in a stoma? Yes. Those, they're not gonna ask you how you empty stoma. What food? Hey, no more. And when you empty in the stoma, where do you sit? Standing up. Oh, this is it. They give you 4 pictures. The patient emptying the stoma. Do you stand up? Do you lay down? You sit on the toilet. Always, and they give it to you in pictures. Any question? No more? All right, Koneti, what's up one? Now, colostomy irrigation. How do you irrigate? What does irrigation mean? Method blue, lavage. Now, you can clean the stoma 2 ways. By doing the irrigation on an IV pole, or you can just do it like you're giving an enema. You can do it 2 ways. Now, the book, NCLEX love to ask you the old way with the IV. You see, the pole, you put the bag, and then you clean the stoma. They ask you, how far is the bag from your shoulder? Maybe. Wet, right here. Enema is given through the stoma, yes. Lukewarm water is infused through the stoma. The water and stool are allowed to drain. If the client is ambulatory, he can walk, position him sitting. If the client is on bed rest, position him on his or her side. Hey, guys, all this is what the people ask you. Green boxes, diamonds are your best friend. What's boîte vert? May all that apply, drop. May you. Green boxes, diamond, this when you want to. Photo. The things you don't read, I see a picture, I ain't gonna read it. Those are your NCLEX. That's what they ask you. Okay? This one, put NCLEX on this for me. Hang the irrigation. Where? Hang the irrigation so that the bottom of the bag at the level of the shoulder. Where do you hang it? At the level of the ear, the level of the shoulder, the level of the head. Maybe boxes. That's your NCLEX. You want to pass? This is your ticket to passing. Know the green box. Know your diamonds. And know what topic things fall under. Guaranteed license. Right here. Now, under, look. It say, when do you irrigate? Boom. In the morning, in the evening, Look, irrigate around the same time each day. Okay, or you can irrigate 1 hour after meal. Mete NCLEX. So now, when we do test-taking strategies, and I ask you, colostomy, all the students say, med-surg GI. I say, I don't teach colostomy and GI, but it's GI. In this book, you teach colostomy in GI cancer. Yes, which I don't do, but I do the colostomy and the ileostomy. Any question? All right. Now, then we go to lung cancer. Very big on NCLEX. I'm on page 512 in the small intestine, in this area here. Okay. Then we go into lung cancer. When lung cancer spread, it goes into the what? Brain. That's why you do EEG. You know who died from this? Donna Saunders. She died from lung cancer. She lived 2 minutes from the World Trade Center. This lady never smoked a day in her life. She just died in 2005 of lung cancer. Now, when you have lung cancer, right? So here's the lung. The lung have lobes. Yo leo lobes. Me lobes yo. When you have lung cancer, we try to fix it 2 ways. If the whole cancer is in the whole lung, we will do something called pneumonectomy. Na pe tire tout lung lan. Pneumonectomy. Okay, if the cancer is in the whole lung, we're going to get a pneumonectomy. If the cancer is only piece of the lung, we're going to do what we call a lobectomy. Lobectomy. Now, petit le morceau. Jamaican student, what I just said, you removing piece. So now look, guys, if the whole lung cancer that is called pneumonectomy, we're going to remove the whole lung. If piece of the lung, we're going to do a lobectomy. Y'all with me? All right. Now, here is where your NCLEX question come in yet. I want you guys to go to page 207. 207. Chest tube. I promise on my license. It's 140 of you guys in here. I guarantee you 120 gonna have on chest tube. You cannot open Pearson door without doing the chest tube. So we're going to do the chest tube, right? The chest tube is on page 207. And I'm going to slay it. That's how you say it, right? Slay it. Okay, chest tube. Okay, so we won't finish tomorrow. But chest tube, you're going to write. I'm going to fix all your problems because the students, the school, never can explain the chest tube. You're going to go to 207, and I need a reader. You're going to read for me, and then I'm going to do the work, okay? Now, when do we put the chest tube? We put the chest tube when we do a lobectomy. En créole, lobectomy c'est morceau dans langue pas bon. English, it's when piece of the lung no good. So we don't want to remove all the lung. Na petit le morceau, right? So they're gonna put a chest tube. Now, a chest tube is put in when you have air, water, or blood. When you have air in the lung, you have something called pneumothorax. Pneuma. When you have blood in the lung, you have hemothorax. Maybe what the chest tube. Done. The chest tube, and I'm going to do all the work for you. The chest tube is another name for it is called plurivac. Plurivac. The chest tube has 4 compartments. A, D, 1, 2, 3, 4. The chest tube has 4 compartments. And when do we put the chest tube? To remove what?
Air, water, blood.
When air in my lungs, what do you call that? Okay. Now, this here is positive air. In our body, we call it negative space. Yes, I want air to go in. I want air to go in my body, but it has a job. It has to go in properly. I take the air and it filters and it goes in. That's how air's supposed to go in. I don't want to shoot Robin and air go in. No good. That's not good. I want Robin to take the air by filtering it and it goes in the lungs. Any question? Now, the chest tube has 4 chambers. This is the way you're going to read for me. You're going to read B, collection chamber, and the intervention for B, and I'm going to do the work. Everybody with me. The way you're going to follow her, you're going to read collection chamber, and then the intervention. And then she's going to read, I'm going to do the lecture, and then she's going to do intervention. Let's go.
Collection chamber, where the chest tube from the collection connects to the system. Drainage from the tube drains into the collection and into and collects in a series of calibrated columns in this chamber, water seal chamber. The tip of the tube is underwater, thus allowing
No, don't go to water seal. Collection. So she read the collection chamber. So the first column is called collection chamber. Ça c'est de l'eau sale. Miss Sonia, this is the dirty water. This is the drainage. When I come to work, the dirty drainage have numbers. Look. Right? So we say 50, 100, 150, 200. So I come in, I mark it with a piece of tape. So suppose I had this tube for 3 days. Should the water be going up or should the water go down? Down. Go to intervention. So the first column of a chest tube is what type of water? Drainage, which is called what? Collection chamber. Read the intervention on collection chamber.
monitor the drainage. The physician is notified if the drainage is more than 100 ml per hour.
Stop. I got it at 10 o'clock. Isn't it normal you're going to see it's going to be more than 100? So you got to read your NCLEX question. They say 2 hours after chest tube, la touche please passer 100. Do you feel me? If they put 2 days post chest tube and it's more than 100, you need to call the doctor. But if it say, the patient had a chest tube at 8 a.m. today, and you walk in the room and the collection chamber have 100, you better not call the doctor. It's what? Expected. C'est là. Again. Yes, it said call the doctor. If it's more than 100, but you gotta see when did I get the chest tube. This is where NCLEX get you. Guys, it's 10 o'clock. I had chest tube today. It is normal for you to walk in the room for me to have 200. I just got it. But 3 days later, I'm 100. Hey, it's a medical. All right. All right. Little solid, dirty water. What I tell students, just put DW, small. Deep, dirty water, the drainage, underneath.
Or if drainage becomes bright red or increased suddenly.
Yes, so look. Listen, I got it at 10 o'clock this morning. Isn't it normal that it'll be bright red? Yeah. 3 days later, should it be bright red? No. This is what I'm talking about. The problem with the students, you don't look at the date. You see bright red, you say, hey, no good. But you gotta see if I just got the chest tube or if I got it 2 or 3 days later. Any question? Baby, 1 day after, it still shouldn't be bright red. Not bright red, not bright red. It should start going down. The water start going down, and it should start going from bright red to like a little brown. See, time heals. So as time go by, you should get better, not worse. Any question? So everybody, the first chamber in the chest tube is a what? Hey, you ain't gonna see dirty water. I'm just giving you a way to not show you. Right? Let us see my money. Second, okay. Not a second now. What point lock? Water seal. All right. Ooh, Lord. Water seal. Go ahead, read.
Water seal chamber. The tip of the tube is underwater, thus allowing the fluid and air to drain from the pleural space and preventing air from entering the pleural space. Water oxytates moves up as the client inhales and moves down as the client exhales. Continuous bubbling indicates an air leak in the chest tube system.
Yes, God. Listen. When you have a chest tube, when I walk in the room, I look at the water seal. I should see fluctuation. What's that fluctuation? Like a beach. Monter en l'air, tomber. I didn't have fluctuation. If I don't see fluctuation, couple of things. Either a leak, a kink, or the lung has re-expanded. Again, water seal, I should see fluctuation. If I don't see fluctuation, it's because 3 reasons. A kink, a kink, right? A leak, or a lung has re-expanded. That is why anytime you walk in, you don't see fluctuation. You should always assess. Always assess to see if it's the kink, if it's the leak. Yes. So that's why your questions, those who do million questions, they ask you, what would the doctor order when you don't see fluctuation? Chest x-ray. You know why? To see if the lung has what? Okay. Now, go to intervention. Yes.
The extraction, you say that's the air supposed to be in the chamber.
Bon, encore?
You say the fluctuation.
No, it's not air. The fluctuation is the way you breathe it. Fluctuation, faut que l'eau a monté, e descende. Parce que what we breathe. So anytime you walk in the room, where should you see fluctuation? In the water seal or the collection chamber?
Water seal.
NCLEX asks you that. The NCLEX asks you, how many chambers you see water? 2. You see water here, and you see, hey, you don't see water here. You see dirty water. They ask you, how many chambers you see clear water? These 2. Go read intervention. Yes.
That's the number one was supposed to be in the chamber.
In the water seal, you should see fluctuation. Read intervention, go into the bottom.
Water seal chamber, monitor.
Loud. Read this one. Loud.
Monitor for the fluctuation of the fluid level in the water seal chamber. Fluctuation in the water seal chamber stops if the tube is obstructed. If a dependent loop exists, if the suction is not working properly, or if the lung has re-expanded. If the client has a non-pneumothorax, intermittent bubbling in the water seal chamber is expected. As air
Hey,
is
stop. There's something it says. What did the school teach us? Bubbles are no good. Well, I'm here to tell you, intermittent bubbles it's only gotta go, is good if you have pneumothorax. That's an NCLEX question. Intermittent bubbles in the chest, in the water seal, is good. Only if you have a what? Continuous bubbling is not good. So NCLEX asks you, the patient has pneumothorax, and the patient have intermittent bubbles in the water seal. Guess what you put? Call the doctor, emergency. That is documented as what? Is expected. But the school taught us to what? Call the doctor for all bubbles. Esquinue. You see the water seal. The water seal, intermittent bubbles, is excellent if the patient have a what? Make sure you remember that. So NCLEX asks you, which chamber you see bubbles? The students say, you don't supposed to see no bubble. Well, guess what? If the patient have a pneumothorax, it is normal in water seal. You see intermittent bubble. That is on your NCLEX. Make sure you know that. You got it. Continue reading, Mama.
As air is drained from the chest tube, continuous bubbling indicates an air leak in the system. Notify the registered nurse and physician if there is continuous bubbling in the water seal chamber.
So that means continuous bubbling is what? Is no good. But intermittent bubbling is only good if there's a what? Any question? It will on and popping, because those are the questions they ask you, because those are the tricky questions. Now, you're going to take it from the third one, up here. Suction control, this one. Suction control. Hey, and then, let me tell you what they do to you, too. They give you the chest tube empty, and they ask you to fill in the blank. Which one is collection chamber? Which one water seal chamber? Which one suction control? What job student you don't know? What? You gotta feel it. Yes, go ahead.
Suction control chamber provides suction which can be controlled to provide negative pressure to the chest.
filled with various levels of water to achieve the desired level of suction. Without this control, lung tissue could be sucked into the chest tube. Gentle bubbling indicates that there is suction. It does not indicate that air is escaping from the pleural space.
So, gentle bubbling is what? Is expected. Vigorous bubbling is what? Okay, so let's put the bubbles in perspective. So we don't have no problem with the bubbles. So let's go. Water seal. Right? Intermittent bubble. Intermittent bubbles is normal if what? Job. Okay, that's it. Okay. Continuous bubbling is what? Bad. Continuous bubbling is bad. True? True. So I say water seal. Suction control. Right? You have two bubbles. You have vigorous bubble and what the other bubble? Gentle. Gentle. Bubbling is what? Good. And vigorous is what? Bad. So guys, the school taught me, Nova 2, $120,000 later, that bubbling in the chest tube was no good. I swear to God. That's what the teacher taught me. She was Jamaican. She said, my mind, the bubbling are no good, you know, so. I said, what? I had to go read, and I learned. Yes, bubbling is good. Hey, bubbling is not a bad thing. It's not a good thing. You got to see where the bubbling's supposed to be. The chest tube patient always gonna be the patient you going to see first. Anytime I have a chest tube, you must see me first. Now, in the last one is what we call the last one. You go dry suction. You don't even have to go there. Dry suction come with a suction. It's a little red thing, and the doctor decide what he wants, how much he wants the machine to suction for. Okay? Any question? Now, NCLEX asks you, where do you keep the chest tube? Below the level of the what? The chest. Not on top. Here it is. Can I clamp? Clamping is done with a physician order. Anytime a patient have a chest tube, you will have a clamp with it. However, you cannot clamp until if there's an episode, you will clamp, but you must call the doctor to get the order. Now, did NCLEX ask you, what do you do if the chest tube come off? If the chest tube come off, old nursing, you take petroleum jelly to prevent air. Old nursing. Now nursing, if it come off, you put sterile dressing or sterile gauze. Any question? This will be on your test. They ask it with respiratory, by itself. You must know about chest tube. Anytime you have a chest tube, we must do ABGs. A LPN for NCLEX, you will never work with this patient. Always nurse. Why? Let me tell you why. When you have a chest tube, you are at risk for something called a medial sternal deviation shift, which make left heart, which is clean blood mixed with dirty blood. So can put the patient in heart failure. C'est peut-être ça. NCLEX, LPN don't work with no chest tube patient. Because of the heart failure, this chest tube can cause the patient. Some people call it tension pneumothorax. Yes, ma'am.
Ms. Sonia, I had a friend that took the NCLEX. She had a question like where, I mean, they have options like where should the chamber go? Like where they carry the chamber? Is it on the table, in the bed?
Under the bed, under the bed. The chair, it never go on the table, mama.
Okay.
Right under, it tell you, did she pass? I know she ain't come here either. You know why? 'Cause baby is right. Look, mom. Number 8, did you show her? See, say keep the drain below the level of the chest tube. See, they ain't gonna ask you that, mama, because you got that slave. Laid. Right? Easy. Slave. All what they asked her was right in this little book. No, baby, ma'am, number 8, page 208. Chest tube, go from page 207 all the way to 208. 20, yeah. Yes, anytime there's a chest tube, there always will be a respiratory therapist on board. Yes, ma'am.
Are you saying, when you got the chest tube, you can use the kingdom to the...
No. What you at risk for, c'est peut-être ça. Mon LPN va travailler avec patient. Patient with chest tube, that's a critical patient.
What's the name of it?
It's called medial sternal deviation shift.
Can that happen with 2 years after that? or-
Yes, it can. It can. Because of long-term chest tube, it causes the heart problem. Yes, it can. Any question? You see, we left here, right? We cool? All right, mañana. We moving on.